Whooping cough is on the rise, but why?
The sky is falling! The sky is falling!
Whooping cough or pertussis is caused by the bacteria Bordetella pertussis. It spreads from person to person through respiratory droplets from coughing and sneezing. Whooping cough is when a child coughs and then as they try to breathe in, there's a sharp, high-pitched sound called a whoop.
There we go.
The cough can be so bad for those that are really young, it can even cause vomiting and lead to trouble breathing. Babies can have such a hard time catching their breath, they may need to be hospitalized. Whooping cough is diagnosed based on someone's symptoms, but can be confirmed with testing of nasal swabs. So why is pertussis on the rise?
Why, indeed.
Well, actually, pertussis cases took a sharp decline during the COVID lockdown, and for a few years after, with cases ranging from 18,617 in 2019 pre-pandemic to 2,116 cases in 2021 with COVID precautions. Now, cases have risen to pre-pandemic levels with 10,000 cases reported by June 1st of this year, with the easing of distancing and masking. Why should we care and what can we do?
Oh, right. Why should we care?
1 of every 3 babies less than 12 months with pertussis have to be hospitalized due to not being able to breathe well. Vaccination of children with the DTaP vaccination for those less than 7 or Tdap for those older than 7 can help prevent and minimize the symptoms of infection.
Vaccines really do work. My mom used to vaccinate me like every month and I never got sick.
Vaccination of those younger than 7 prevents 98 of 100 of those vaccinated within a year of the last shot from getting whooping cough and 7 in 10 of those within 5 years of the last shot. In addition, vaccination of mothers during pregnancy with the Tdap vaccination prevents 9 in 10 babies from being hospitalized with whooping cough. To learn more, see the link to the CDC website down below the like button. And if you want to learn more about a new test for colon cancer screening, click on the video here. I'm Dr. K from iMedicalSchool, and remember to keep learning.